Imagine a bridge. This bridge allows vital nutrients to flow through your body. This is similar to what an arteriovenous fistula, or AVF, does for people with kidney disease. Now imagine that bridge needs a little repair to keep the traffic moving smoothly. That's where Percutaneous Transluminal Angioplasty, or PTA, comes in. PTA is a minimally invasive procedure. It uses a tiny balloon to open up narrowed blood vessels. AVF is a surgically created connection between an artery and a vein. In patients with kidney failure, AVF is crucial for dialysis. Dialysis is a life-saving treatment that filters the blood when the kidneys can't. Both PTA and AVF play a vital role in healthcare. They improve the quality of life for countless individuals. When kidneys fail, they can no longer filter waste products from the blood. This is where dialysis becomes a lifeline. Dialysis requires access to a large volume of blood flow, and AVF provides this access. During a surgical procedure, a surgeon connects an artery directly to a vein, usually in the arm. This connection creates the AVF. Over time, the vein, now connected to the high-pressure artery, becomes stronger and larger. This makes it easier to insert needles for dialysis. AVF is the gold standard for dialysis access. It is preferred over other methods. This is because AVF generally lasts longer and has lower complication rates. Like any bridge, an AVF can experience wear and tear. Over time, the site of the AVF can narrow. This narrowing is called stenosis. Stenosis restricts blood flow, making dialysis less effective. This is where PTA steps in. PTA is a minimally invasive procedure used to treat stenosis in an AVF. By opening up the narrowed blood vessel, PTA helps ensure smooth and efficient blood flow for dialysis. Without PTA, a narrowed AVF could clot off completely. This would require another surgery to create a new access point. The PTA procedure might sound intimidating, but it's actually very straightforward. It's performed by an interventional radiologist or a vascular surgeon. Here's a simplified step-by-step breakdown. First, the area around the AVF is numbed with local anesthesia. Patients are awake during the procedure but should feel minimal discomfort. Next, a thin needle is inserted into the AVF. A contrast dye is injected to help visualize the blood vessels. Then a thin tube with a deflated balloon at its tip is guided to the narrowed area. The balloon is then inflated, pushing the blockage aside. Finally, the balloon is deflated and removed, along with the catheter. The puncture site is bandaged. The entire procedure generally takes less than an hour. Patients can usually go home the same day. PTA offers numerous benefits for patients with AVF. The most significant benefit is the restoration of blood flow. This translates to more effective dialysis sessions. Other notable benefits include minimally invasive. Compared to surgery, PTA is less invasive, resulting in less pain, scarring, and shorter recovery times. Outpatient procedure. Patients typically go home the same day, reducing hospital stays and associated costs. Improved AVF longevity. PTA helps maintain the AVF's health, potentially extending its lifespan. By restoring and maintaining the AVF's function, PTA contributes significantly to the patient's overall well-being. Navigating the risks, potential complications of PTA. While PTA is generally safe, like any medical procedure, it does come with potential risks. It's crucial to be aware of these. Bleeding. There's a risk of bleeding at the puncture site, though it's usually minimal. Infection. As with any procedure involving needles, there's a small risk of infection, damage to the AVF. In rare cases, the balloon or catheter could damage the AVF. Restenosis. The treated area might narrow again over time, requiring repeat procedures. It's important to have an open and honest conversation with your doctor about the potential risks and benefits specific to your situation. Stories of success. Real-life examples of PTA for AVF real-life experiences can illuminate the impact of PTA. Consider the story of a 60-year-old woman named Sarah. Diagnosed with kidney failure, Sarah relied on dialysis through her AVF. Over time, her AVF narrowed, making dialysis less effective. Sarah underwent a successful PTA procedure. The restoration of blood flow significantly improved her dialysis sessions. She experienced less fatigue and a renewed sense of well-being. John, a 55-year-old man, also found relief through PTA. His AVF narrowing caused discomfort and anxiety. Following PTA, his anxiety subsided, and he could focus on managing his health with renewed optimism. These stories highlight the positive impact of PTA on patients' lives, providing hope and improved quality of life. Your health, your choice. The importance of open communication. When it comes to your health, knowledge is power. If you or a loved one require dialysis through an AVF, understanding PTA is crucial. Don't hesitate to ask your healthcare team any questions you may have. Open communication ensures you're informed about all aspects of your treatment. It empowers you to make the best decisions for your health and well-being. A partnership for life. Working with your healthcare team. Your healthcare team is your partner in managing your health. They are there to provide support, guidance, and the best possible care. By working together, you can navigate the challenges of kidney disease and maintain the best quality of life possible. Remember, you're not alone in this journey.